All right, well, good afternoon, everyone. My name is Ben Wormser. I'm the medical director of the Maternal and Child Health Bureau at Maryland Department of Health. I'm also a pediatrician, a father, a husband, and pertinent to this group, I'm the brother of a nurse midwife and the son of a nurse midwife also. Um, Today's been pretty amazing, hasn't it? Yeah. We've heard from many really thoughtful Marylanders who are doing the work. They've been public health leaders, birth workers, clinicians, researchers, mental health specialists, our First Lady, and of course, birthing people from across the state. They've shared from their own personal experience, their research, and their lessons learned from lifetimes of helping birthing people. Together, they've graced our collective community with the opportunity to think, reflect, and to partner in action. I hope that each of you has connected with someone today who is doing work that you're excited about and inspired by. From here, our task at hand is multifold. First, it's to continue to grow this special community that we have here today, to make sure that Coppin State has to open a bigger auditorium for us for our next summit. Second, it's to do more to engage with communities disproportionately affected by maternal mortality and morbidity, and to ensure that the system promotes their voice instead of silencing it. And finally, it's to engage tomorrow with our clinical partners, our legislators, our community-based organizations, and our payers to educate them and to help them to use their collective ability to ensure every Marylander survives and thrives in pregnancy and beyond. If you aren't sure where to go next, consider the Maternal Mortality Review Program's recommendations. They're available at the end of each maternal mortality review report that gets released, and they're all available on the Maryland Maternal Mortality Review Program website. These recommendations are produced by a multidisciplinary team who work every day to support birthing people. And even if you already know how you want to help, but maybe you need a little bit of support with that, remember that these recommendations can also be used as a resource to inform systemic change. If a recommendation aligns with what you are trying to achieve, it provides further evidence backed by a multidisciplinary panel for your effort. And then there's one final element of this work that we have heard a lot about today, but which isn't always called out explicitly. I think I've heard about it. I've heard it in every one of the presentations today, and that's really humanity. It's the underlying sense that we as a collective community need to find a way to redesign the system so that the default action, the easiest way to provide care, is with the love, compassion, and mutual respect that our hearts call for. On behalf of the Maryland Department of Health, the Maternal Mortality Review Program, and all Marylanders, I thank you for joining us today. And in recognition and solemn reflection of all that we've heard today, all that we hope to continue to do tomorrow, and of those we have lost in birth, I invite you to join us in a closing moment of silence. Thank you. Our final speaker for today is Lady Brion, an international spoken word artist, curator, activist, organizer, educator, and executive director of the Pennsylvania Avenue Black Arts and Entertainment District. She received her BA in Communication and Culture from Howard University and her MFA in Creative Writing and Publishing Design from the University of Baltimore. It is my absolute pleasure to introduce Lady Brion.
Good afternoon. How is everybody doing? Good, good, good. So do I have any fans of spoken word poetry in the building? Okay, perfect, perfect. All right. I feel like my tribe is here. Okay, great. So I invite you, as I read this poem, if you hear anything that resonates with you, that speaks to your spirit, you don't have to wait to the end of the poem to show your exuberance. So y'all can snap. Everybody try it. Everybody can say, try it. You can even put them together. Or if you're really vocal like me, you can throw a yes, okay, I hear you. Whatever you're feeling in the moment, I encourage you to throw that up to the podium, okay? All right. So this is a poem that I wrote for you all today, and it's entitled Braxton Hicks. Braxton Hicks is known as a type of false labor, where contractions make it difficult for many women to tell if their body is ready to deliver a baby or not. And every year, thousands of women are turned away, told to wait it out at home, and it's ironic how good we have become at telling women what is not an emergency. Treated like they're crying wolf when they're howling in pain. I still remember the way a hospital made a question mark out of me without ever attempting to answer the riddle of my condition. Over the course of 3 years, I saw 6 different doctors trying to understand why my menstrual was such a mysterious thing. Doctors asked me if I wanted to have children, but when I said no, they stopped searching for solution and instead sent me home. I guess this factory of a body is only as good as what it can produce. During a recent surgery, I learned that both my ovaries are full of cysts, a condition as common as Braxton Hicks, but not one doctor ever thought to examine my abdomen in search of it. There is a silent alarm blaring, but no one's listening. There is a trail of women who have lost their body, who have lost their lives to indifference. A patriarchy that has buried their torment so deep that we don't even see it. Between 700 and 900 women suffer from pregnancy-related deaths every year in the U.S. Another 50,000 births cause life-threatening complications, and there are clinics where women fall victim to obstetric violence, but we must break through the silence so we can hear her. With all the bodily changes she's endured, she needs someone that'll be here for her. They say it takes a village to raise a child, but I say it takes a village to save the child bearers. So to the doulas and the caretakers, to the doulas and the caretakers, partners and family members, search for unnerving signs. Ring the doctor's line the moment things feel misaligned. And even when she says she's fine, check her breathing. Is she bleeding, swelling in her hands and face? It may seem extra, but ain't it better than watching her give way to death's embrace? We must all inquire, then conspire to revolutionize the health system, require an equitable standard of care no matter the symptoms, where providers check their bias at the entrance so that a person's race won't erase their quality of care. The way we treat mothers is a litmus test for our humanity, because women should never stand alone when they're literally growing generations manually, but we as women are always made to push through hard labor, lest we see sections of our dignity disregarded and the healthcare system's unconscious bias be a pain in our side like contractions, never knowing if today's discrimination is just a Braxton Hicks or the one that'll deliver a death certificate. They say 80% of maternal deaths are preventable if only early warning signs were seen or women's pleas were acceptable. Braxton Hicks cautions mothers to wait for the water to break or a bloody show, and ain't that typical? For a woman to billboard her suffering before it's believable. But what would it look like? What would it look like if the world just listened to her instead of lacking backbones like spina bifida? Like if we really stood up for each other. Because if for nothing else, let our own existence bear witness that none among us would be here if a woman had not broken her body open to usher in this flesh. So at best, open your mouth as a thank you for your own own breath and use it to call for change.